Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends impacting the industry today. My name is Justine Giancola. I'm on the corporate communications team here at Inovalon, and joining me today is Mike Jones, the president and general manager of our payer business unit. This episode is part of our mini-series where we look specifically at 2025 and what our internal thought leaders predict will be top of mind in the healthcare technology space. Today, Mike and I will be discussing integrated solutions and complete member data. Thanks for being here today, Mike.
Thanks, Justine. Glad to be a part of the podcast.
So to get started, can you tell me what some of the challenges that health plans are going to be facing in terms of regulatory reporting in 2025?
Sure. Well, first of all, let me say that measurement year 2023 was a very difficult one for most plans. We saw decreased star ratings across the board, which does have financial impacts in the market. When you couple that with the lawsuits that came from those reduced stars ratings and the increased audit pressure from the Department of Justice, some of the plans have seen serious financial impacts. Now, looking forward, we expect that to continue in the coming years. And you see that we have a new administration coming in this year that will certainly have potentially impacts on government programs like Medicare and Medicaid. And we're still seeing the ripple effects from the Change cybersecurity event that happened in February. So putting all that together, there will be an increased scrutiny across harvesting diagnoses from only in-home assessments or medical record reviews. So we expect that CMS and OIG are going to continue to want plans to put the PCP at the center of all member care through tying diagnoses to actual member visits.
So a follow-up to that question, there has been increased discussion around chronic diseases in the market. How do you think that that's going to play into the 2025 discussion?
Chronic diseases will certainly remain top of mind in 2025. Now, mental health will always be a focus, but the three other main diseases that will be in focus are diabetes, obesity, and chronic pain. The recent increase in availability of GLP-1 based drugs for prescription for several of these chronic diseases is going to become a focus in 2025. CMS has even indicated that in their recent proposed rulemaking that GLP-1 may be covered. But the question is, will the health benefits of GLP-1 outweigh the additional costs associated with things like obesity plans that need to be released and monitored along with those prescriptions? Having healthier members will certainly decrease drug, disability, and healthcare claims, and it will also decrease absenteeism for employers, so it can have a big impact for health plans going forward.
So how can health plans go beyond solving for quality measurement and risk adjustment? What does more complete member care look like?
Complete member care is the process of widening the lens of information that you have around any single member. A lot of times in a plan, there are silos between the various different benefits that a plan offers to its members, and that can really inhibit the capability to take care of the member as a whole. So breaking down these silos and creating a more complete picture of member care, including PCP visits, urgent care visits, lab information, all the data that we have at hand can really help the plan to create and foster better complete member care.
So what would you say that more complete member view means for advancing health equity?
Well, by creating a more complete and holistic view of our member, you can also add into it social determinants of health data, HEOR data, and other social risk factors so that you can paint that full picture. And then plans can help to address the disparities in healthcare that can occur in different socioeconomic classes of members. It's really key for both the payers and the providers to be able to have this complete care, and so that they can use the technologies and services that they can provide to address those disparities in healthcare. So this Disparities of Health and Health Equity Index is becoming a regulatory requirement in 2026 for the HEDIS CMS measurement plan. So it's going to continue to be at the top of mind for all of our health plans, and we as vendors need to continue to provide tools and data that can help them address those disparities.
Okay, Mike, last question today. Can you tell me what your number one prediction is this year for the payer space?
Well, I'll give you a couple. First of all, it's been stated that the healthcare industry loses over $600 million a year to fraud and insurance abuse. And because of that, it's going to remain a focus in the industry going forward. We will need to make sure that interventions are done on the right members at the right time and in the right way. So we expect from this that there will be an increased need for accurate analytics that will drive the right interventions for the right member at the right time. On the regulatory front, the increase in risk adjustment audits will convince plans to abandon their heavily in-home assessment-related adjustment plans in favor of plans that put the primary care physician at the center of the strategy. Secondly, AI will continue to have an impact across healthcare, but especially in our payer paradigm. It's significantly changing our ability to turn non-discrete data into discrete data that can then aid in medical coding and abstraction for members, as well as in data analysis and other utilization. So the impact of AI will just continue to increase across the payer paradigm.
Okay, Mike. Well, AI certainly has been a topic of conversation in the healthcare space, so we're really excited to see how that continues to evolve in 2025. Really appreciate you taking the time to share this insight with us.
Thanks, Justine. Glad to be a part of it.
And of course, thank you to our audience for tuning in. Be sure to check out the other episodes of our Trends and Predictions mini-series.